Welcome to Recovery is Health, Health is Recovery Lunch and Learn series. My name is Randy Pedersen. I'm the Syringe Exchange Program Manager with the Idaho Department of Health and Welfare. And I'm an all-around harm reductionist. I'm very excited that you've joined us today for this series. As many of you know, September is National Recovery Month. And this year, our partners at Department of Health and Welfare, Recovery Idaho, Idaho Harm Reduction Project, and the Northwest ATTC are collaborating to provide this Lunch and Learn series. It's really focused on health topics in recovery. So it's a course of 6 sessions. We'll discuss topics ranging from harm reduction, infection prevention and treatment, and smoking cessation. And the sessions will be held every Wednesday and Thursday throughout September. So just a few housekeeping items before we transition over to our wonderful speaker today. I encourage you all to introduce yourself to your peers in the chat. We will hold questions for the end of the presentation, but please feel free to add those into the chat as well. And please note too that there is an option to just message panelists and the presenters as well if you'd like a little more privacy for some of your questions. So today in part 2, we're going to discuss HIV. And our colleague Marcial Angula will be presenting. Marcial was born and raised in Nicaragua, and he's worked for 5 years as the HIV medical case manager at Full Circle Health, which is a Ryan White Part C clinic based here in Boise, Idaho. And we are very lucky to have Marcial join us at Department of Health and Welfare about 5 months ago. And he's working as a health program specialist with us, really trying to raise up HIV prevention efforts across the state. So he is very passionate about improving community well-being and equity in Idaho. So Marcial, I'll turn it over to you.
Hey, perfect. Thank you, Randy. Can you hear me?
Yes.
Awesome. Well, good morning, everyone. It is such an honor presenting to you this morning. Let me share my screen here with you. Perfect. Can you see it now?
Yeah, it looks great, Marcial.
Awesome. Okay, so good morning. Such an honor presenting to you this morning using the Recovery is Health, Health is Recovery's platform to bring to you what is happening regarding HIV prevention in Idaho. My name is Marcial Angula. Kevin Bruniger is with me to reinforce information and helping answering questions. I'm the health program specialist for the HIV prevention program. I've been in this role for about 6 months. Before me, it was Kevin who was doing this job. I hope this information gives you a better understanding on how the Department of Health and Welfare is incorporating initiatives to reduce HIV infections in the state of Idaho. We have an hour scheduled for this presentation, but probably it will be less than that. I'm going to turn my camera off just to avoid issues with the connection, but I'll return back once we finish the presentation. Okay. A little bit different working with Zoom than WebEx. Okay, so here, first, I just want to provide you a quick tour where we are located into the Idaho Department of Health and Welfare. As you can see, the HIV prevention program is only a small part of the entire section. The HIV, STD, and hepatitis prevention program are under the Division of Public Health, housed in the Bureau of Clinical and Prevention Services. The section also housed the HIV care, the syringe exchange, and the DIA works for capacity building programs. HIV prevention is just a tiny piece of this huge structure. In this slide, we can see the collective functions of all the programs in the section. The monitoring of STD screening rates. Here, the surveillance program, which is housed within the epidemiology program, leads this function. They do follow up to determine potential outbreaks conditions to avoid transmission clusters, and they use the National Electronic Disease Surveillance System-based system known as NBS to track all this information. The STD prevention, same as the HIV prevention, this program is focusing on reducing, following up, and providing funding to reduce infections. And the education and outreach activities, partner services, linkage to care, program evaluation, policy development. These are big components and functions of basically all the programs in the section have in common. They are strong indicators to help us to spread information and accomplish goals. As I mentioned previously, the surveillance programs play a crucial role in these functions. They are the staff who are receiving, maintaining, and analyzing the HIV and STI data from labs, from providers' report, and from the health districts. So from here on, we'll start landing on what HIV prevention means and what are the strong components that the state is adopting to implementing and reduce the spread of HIV infections. First, the big question, what HIV prevention services means. Well, based on the annual analysis from the CDC, HIV prevention is defined as any service or intervention that is directly aimed to reducing risk for transmitting or acquiring HIV infections. That's such a short statement, but has a meaningful outcome. So the HIV prevention, same as the other programs in the section, received funds from the CDC to conduct prevention activities that aim to build strategies and efforts to that are going to facilitate access to resources. The HIV prevention program has 4 program components: the HIV testing, the condom distribution, the PrEP support, or prevention with non-HIV positive individuals, and the HIV partner support. Lastly, but not least, there are other resources that will be mentioned later in this presentation. All these components are aiming to reduce new infections, increase access to care, improve health outcomes for people living with HIV, and promote health equality. So before going in full of each component, let's take an update on where Idaho is standing regarding to providing medical services to Idahoans and who is considered a priority population for our program. First, let's take a look in the Idaho workforce capacity. So here, the state of Idaho is defined as a health professional shortage area, with many areas experiencing very limited access to primary care physicians. Idaho has 64.1 primary care physicians for every 100,000 people. The primary care provider ratio is lower than similarly challenges low incidence states such as Wyoming, Montana, and Alaska, even though these states have smaller population than Idaho. Also, providers are distributed primarily in the urban core, which means the Treasure Valley, to a lesser extent semi-urban area, which is Pocatello and Coeur d'Alene. There are few providers willing to provide care for people who are uninsured, and for people living with HIV, the lack of provider is magnified since some providers do not want to serve HIV positive patients, or they don't want to gain training about HIV. For individuals living with HIV or AIDS, the need is much greater for HIV specialty care resources. Infectious disease specialties offering HIV specialty care in Idaho are located in the major population center of the state, and Boise has the majority of specialists. So circumstances like this have allowed the HIV Prevention and the HIV Care Program to successfully leverage funding with other entities to support a statewide HIV testing, care, and treatment. Also, it is clear-based evidence that is pushing the public health sector to identify alternatives that counteract the impact of health professional shortage in that state. Now let's get a better idea on who lives in Idaho, and also keep in mind that Idaho is mostly a rural state with 35 of the 44 counties designated as a rural area, which means the state faces challenges with access to health care. So how many and who are we? So based on the 2020 US Census, Idaho has a population of 1,839,106 individuals. Of those, 82.1% is white, 13% is Hispanic or Latino, and 4.9% is identified as non-Hispanic or Latino, which include Asian, Native American, Black or African American, and Native Hawaiian. Knowing who is living in Idaho, the problem with the medical shortage, among other circumstances influenced by social determinants of health, our main audience was congregated in 4 groups. So we have MSM, men having sex with men, Hispanic women, Hispanics, and people who use drugs. Considering local cultural challenges, we identified that concerns with men having sex with men are that young men who have sex with men might not identify HIV as a serious disease. And unfortunately, certain areas in Idaho are highly influenced by religious entities, and this might lead to higher incidence of anonymous sexual partner causing unknown diseases. The Hispanic women, most women in this group are affected due to socioeconomic factors such as poverty, the lack of inadequate health insurance, and immigrant status that cause fear to seek medical attention or disclose any disease. A high percentage is unaware of their male partner's risk. The language barrier plays a huge disadvantage, and also studies are showing that they have higher rates of STIs. For example, gonorrhea, in a study published by the CDC in 2018, indicates that the rate of cases among Hispanic women have 1.4 times the rate among white females. And something similar with the Hispanic group, it is a higher percentage of undocumented immigrants, and this increased the fear of seeking medical help, of disclosing HIV or STI status, or simply as being unaware of how the health system works. Also, socioeconomic factors and language are a huge barrier. They have a higher rate of STIs. Same study used previously shows that the rate of reported gonorrhea cases among Hispanic was 16 cases per 100,000 population, which was 1.6 times the rate among white individuals. So data from the surveillance unit by the end of 2020 shows that there were 626 cases of people living with HIV in Idaho, which means 386 individuals. Hispanic were the second group in prevalence, 13% occur in HIV, and also saw the second highest year-to-year increase in HIV, followed by Black or African American with 11%. And people who use drugs, in this group, we have a combination of men having sex with men and drug user. Between 2005 and 2009, this population represented nearly 19% of new diagnosed individuals with HIV. And by the end of 2020, it was 7%. So good work is providing good results. And also criminalization of drug use creates a fear for seeking support, and the stigma against people who use drugs is marginalizing those who need support. That being said, let's see how broad we are as a section and as a program. So what is our scope? Our section holds 20 subgrants and 19 MOUs where no money can be exchanged, and 2 letters of notations where monies are being exchanged, but the total anticipated value of the service over the course of 4 years is expected to be less than $10,000. If we move toward the right side of the slide, we can see that as a program, we have 12 subgrants and 2 MOUs, and currently we are working on a new MOU for a health center in the west of Idaho. So what I believe is really interesting is that the program doesn't have to have a formal agreement to provide condoms to all the subgrants, MOUs, or letters of notation. The fact that already exists a relationship and an agreement with other programs in our sections allow us to buy condoms for them. However, it's not the same for the HIV testing. All the agencies with subgrants have to submit an activity report and also specific information per HIV test conducted to provide to process that is going to process and is going to be explained eventually in this presentation. Well, talking about condoms, let's see how the program supports this initiative. So condoms are made available to all clients attending an STD clinic in a community-based HIV testing location. We, as a section, purchase condom and lubes to all the entities, somehow related to the section, but also all the subgrants are providing the money to the health district to purchase and supply to the respective agencies. Here we can see the condom distribution for 2019 to August 2022. The number of condoms that we have purchased or mailed out from 2019 to 2022 so far is 432,284 units. However, the distribution of condoms, considering the report submitted by the health district and the health partner, is above 1 million. As you can see, numbers have dropped significantly during the past 2 years. We still can see that it hasn't gone back as it used to be. No hesitation that COVID also had impacted the distribution and request of product. Requests decreased, but STIs and HIV cases did not. Just to mention, in those 2 years, 2020 and 2021, there were 12,491 cases of chlamydia and 144 new diagnoses of HIV, being districts 4 and 3 with the highest rate. Also, we have available 3 male order condoms and lubes available to all Idahoans through a partnership with One. This service started on January last year, and so far they have delivered 14,720 condoms. So we have brought of resources to provide condoms to our population. Regarding the HIV testing, our testing supply provides to clinical and community-based facilities. The clinical support testing to those at risk for HIV and support linkage to HIV care. And the community-based provide testing to those experiencing health equality challenges. According to Idaho's 2020 behavioral risk factor surveillance system, only 30% of Idahoans report ever being tested for HIV. From 2019 to 2022, so far, we have purchased around 23,920 tests, and during the same time frame, data reported and submitted from all the agencies and community-based testing showed us that 19,689 tests have been conducted. It doesn't represent individuals because sometimes more than one test is performed in a patient or client. Also, this number definitely is higher because we are not counting the number of tests that other facilities are offering with our own resources. Tests that we provide are Insti, OraQuick, SureCheck, and OraQuick in home. So this slide showed us the number of people diagnosed in the past 2 years with HIV and AIDS, and how many cases so far have been diagnosed this year per district. Adding new cases to previous data becomes sensitive and vulnerable to be interpreted, and it's not a good resource to use when we want to present that X or Y disease is a public health problem. That is the reason why only new cases are being presented instead of a specific number per district. We have to consider that life changes, meaning death or moving to a different state, can lead us to misinterpretation of the data. But I'm confident we can say that Idaho has around 1,200 individuals living with HIV and AIDS, and the areas of higher incident are the health districts 4, 3, 5, and 7, respectively. So moving on, the report piece. To track the amount of HIV tests and collect program activities report, subgrants and MOUs partners are required to report as utilizing the Prevention Activity Report System, or PARS, and the evaluation web. PARS can be part of the health center's EHR, and specific variables must be reported back to the program. Those variables include the test type, the HIV or HCV, the test date, the patient's year of birth, the patient's state of residency, the patient's county or zip code, ethnicity, race, assigned sex at birth, the current gender identity, that previously tested, if they have been previously tested for HIV, and the test result. PARS track this kind of information, but also is collecting data with hepatitis, STIs, and condom distributions information. The evaluation web is the system that collects all the data at a national level, but also is the name of the form that can be used to collect patients' information when the testing is being done in a non-clinical setting and the agency prefers using paperwork. So both source of data collectors allowed us to identify areas where we must intervene and where partnerships with health centers should be accomplished. but also it is the way that we prove that work is being executed as established in the subgrants and MOUs. The PrEP support part, all the subgrant partners, clinical and community-based organizations that conduct HIV testing are required to document PrEP eligibility and referral information for those being tested. We encourage all the partners to promote PrepMeIdaho.com. Likewise, various dating apps and social marketing are promoting it. Providers also can receive education or updates by the Northwest Aid Education Training Center, known as NWAETC, on topics related to PrEP. We support PrEP adherence through funding support to cover quarterly lab costs for patients who are at risk of being infected with HIV, but due to X or Y circumstances, they are not allowed to use their health insurance, or they don't have a way to get PrEP labs. And also the efforts to increase access to PrEP will continue with referrals for HIV testing partners, as well as maintaining an updated PrEP provider resource directory accessible on PrepMeIdaho.com and our locator page as well. And the postcard that we can see in this slide is the one that we can use during referral time, or just as a piece of educational material for individuals who might qualify for PrEP. Also, our local health districts that conduct partner services are making sure that proper PrEP referrals are made during contact investigations. Now, the HIV Partner Services, it is a service where individuals testing positive for HIV are offered a confidential service to notify partners or contacts of possible exposure to HIV and provide testing to those individuals. Partner Services is conducted in all 7 health districts, and our goal is to interview 85% of all new diagnosed HIV cases. And saying last year, due to COVID, we only target 82%. Here we have other support services that we as a section and as a program are providing to the community. The Linkage to Care. Our goal with Linkage to Care is that all new HIV cases are linkaged to care within 30 days of diagnosis and receive a partner service interview, where sexual partners will be identified so they can be notified of the exposure. And from my experience doing case management for HIV patients, if the agency gets a reactive result, they must refer the patient for a confirmatory lab. If the lab was completed at the Ryan White Clinic, they will take care from there and will notify of the positive result to the agency. The agency will notify to the Department of Health and Welfare. And also the clinic will contact the health district to let them know of this new case and when the first appointment will be, so they can be part of it. If that confirmatory lab is done somewhere else, the agency will report to the state, and most of the time they are also contacting the Ryan White Clinic to follow up with the patients for an intake visit. The policy initiatives, we support the Zero Project, which is a network of individuals with HIV that fight for freedom from stigma and injustice. Their focus is ending inappropriate criminal persecution of people with HIV In Idaho, we have the Idaho Code 39.608, which is the HIV criminalization. And original, it was drafted in 1986, and the code includes medical inaccurate information, and those barriers, of course, are putting a high risk to individuals who are experienced or who are being exposed. This law allows for criminal prosecution based on transfer of body fluid, which might contain HIV. However, the wrong statement is that it says is that HIV can be transmitted through saliva or urine. So additionally, the code impact the willingness of those newly diagnosed to accept partner services for fear to prosecution for noticing partners. And according to the Zero Project, more than 17 Idahoans have been convicted under this code. The LGBTQI plus health equity. We work with community-based organizations and clinicals to eliminate stigma through awareness campaign, events, and to deliver all gender and sexual orientation affirming services. We award health equity sub-brand with a clinic in Rexburg that provides mental health and well-being services to LGBTQI plus individuals and family. This year, we sponsored 7 Pride festivals in Boise, Coeur d'Alene, Rexburg, Idaho Falls, Pocatello, and Twin Falls for a total of $39,000. The syringe service program, the goal is to prevent the spread of HIV among people who inject drugs by providing safe syringe disposals, access to syringe, and other supplies used for injection drug users. We have 6 syringe services program currently operating in Idaho, offering services through fixed locations, mobile units, peer average, mail, and harm reduction vending machines. And in 2020, only 11% of the estimated 4,080 people who injected drug statewide access to this program. So there is a lot of work to keep doing in this area. And finally, the mobile testing. 9 mobile clinics were purchased via our program, and there are along all Idaho in District 1, 2, 3, 4, and 6. Outreach and testing events are conducted, and this has been such a good resource to bring the services to the community. Here, this slide shows the online resources that partners and community can access to request or look for resources. That Take Me Home, I think that one is, Take Me Home is this one here. We can see that Take Me Home name on the top of the page. Our goal is to expand the capacity to provide free home test kits to those with access to care, but also for those who are lack of resources in their area. We started offering this service by July of 2020. 503 kits had been mailed out since then. Although we don't know how many of those were actually used or the results, a monthly review of our surveillance system indicates that none of them were subsequently confirmed positive. And 33 of the 44 counties in Idaho have access to this service. Also, we have Let's Get Checked, We established this contract in late 2021 and was introduced and made this year. And the goal with it is to offer free mail order for HIV, STD, and HCV testing. The package includes a finger stick test for HIV and HCV. Even though this is a great resource, at the same time, it's a little bit challenging having the individual collecting the sample, especially the blood by themselves, and sending it back for being analyzed. We have One at Home. One at Home is a free mail order program. It started in January 2021. The program ships an envelope with 20 condoms and lubes discreetly to the requester's door. People can select standard size or an extra large size. And since the beginning, they have delivered about 14,000 condoms. And as mentioned before, PrepMe Idaho, it is another digital platform that provides information and resources regarding PrEP. It includes a provide resource directory throughout the state, which is updated periodically, so people can have access and just find out where the closest provider is to get prescribed with PrEP. We can see the condom and lube request form. This is a website that is that all the community partners use to place condom and lubes orders. We have a contract with Global Protection, who is the leader in manufacturing and distributing sexual health products. The website is checked twice a month, and orders might take about 2 weeks to be shipped to the agencies. There is not a limit on how much is being requested, but the report must indicate how many have been distributed in that community. There is also the rapid test and quality control form. Like the condom and lube request form, this link is given to our subgrants partners. Depends on the type of test being requested. It can be ordered on McKesson website, one of the largest providers on pharmaceutical supplies, or through Biolytical, who is the lab who developed the rapid HIV test. And same, the website is checked twice a month, and the orders take about 2 weeks to be shipped to the agencies. And the Idaho Condoms campaign, this was a special campaign. We currently are working with the HealthMerc, and this is a company that specializes in designing health campaign, and we together work on 16 different designs that are somehow related to Idaho. We plan on providing 2,000 condoms to 92 different agencies along the state. So far, half of them have received the product. And the idea is to create a website where they can place orders and continue receiving the product. Actually, we have a meeting today where we are going to follow up what are the next steps for the website. This slide is showing you two other resources that we have in that section and with the program. IACHA, which is the Idaho Advisory Council on HIV and AIDS. It is an integrated care and prevention committed with a representative from around the state. All of us or all these individuals have the same goal to strengthen Idaho's HIV and AIDS care and prevention programs and reduce the further spread of HIV infections. This group include person living with HIV, population at risk, HIV prevention and care providers, health departments, educators, expertise in behavioral, substance abuse, corrections, health planning, epidemiologies, along with other professional skills. The committee meets twice a year. Since 2019, in-person meetings were suspended, and finally, we're going back with a hybrid format at the end of this month. Through IACHA, we want to incorporate messaging and guidance for further efforts and efforts to different points along the state. We want to increase the amount of members being part of this group. And to be part of it, there is a required IACHA membership that has to be submitted to the committee for a review and approval. And what is being sought is individuals with skills that help us reach in a place with a better, where we can get a better place for those who are experiences issues and who are people living with HIV and AIDS in Idaho. The locator page, this is a page that is a site that provides the Idaho specific services. It groups all the services that the section has available for Idahoans. At the same time, data collected help us to assess areas of the state with greater demand and interest in providing testing. And here, this slide showed us our commitment to keep working and providing resources to our community. We are planning on continuing to work to expand the number of partners conducting HIV testing throughout the state, conduct the increase in the number of referrals made to persons eligible for PrEP, evaluate the success and the challenges faced by agencies so we can get better, increase access to free condoms throughout the state, develop target outreach in areas where demand is greatest, and continue to ensure that data is secure and confidential. And we want to ensure that at least 85% of all newly diagnosed individuals are engaged in partner services through a health district interview. So if you're in Idaho and you would like to get access or more information for one of those resources, do not hesitate in reaching out. We'll be more than happy to provide you with a guidance and a step-by-step process how to get those resources in your facility. Happy to take any questions or reinforce something that didn't click during this presentation. And thank you a lot for your time and attention. I really hope this has been value to you. Our contact information is here in case you want to say hello.
Awesome. Thank you so much, Marcial. So I don't see any questions in the chat so far, but if anybody does have some questions, please feel free to add that to the chat, or I think you may be able to unmute as well and ask them. So we'll just give a minute or so for folks to pipe up. I think while people are kind of ruminating on all that great information, Marcial, I wonder if you might talk a little bit more about the HIV home tests, kind of how that works, and how people can get them, and maybe any concerns about, those that are testing positive on home tests and how they're getting connected to care.
Yeah, totally. So this is the website, and it's pretty cool because people, they can just go by themselves. They can order the test. It will be shipped to their address. And there is the one that is only for HIV, and this is the other one is a combo of STIs and HIV. So the population, they can decide which one works better for them. And of course, there is a follow-up about the results, and they will sometimes, this is not bad to say, but sometimes people, they must be scared to feel the pressure to go to the website and decide going and order those tests. And after that, once they get that reactive results, is when they will reach out the provider or the Ryan White Clinic or their PCP just to have a follow-up. So yeah, it's a good resource. At least it's a good way to have an alert that something is going on. Our intention is have all the resources available for the community. So it's a good paying attention that something is going on with their health, and they will get a result and they will follow up with their provider. But also the websites and the programs are designed to have a follow-up with the patients once a reactive result is getting back from those tests. Kevin, do you want to add something more to that?
No, I think that was great. Yeah, like you said, it's another tool for folks to access the test at home. So if there's any concerns about, going into a clinic and what that might entail, it's another option.
Awesome, thank you. And there's a question in the chat asking about any tips to help with discussing HIV prevention with community members who might be hesitant to really engage in these services because of stigma or their legal status. Do you have any tips for folks about how they could talk to individuals that are at risk and have those concerns?
Do you want to answer, Kevin, or do you want me to go?
Oh, you can answer.
Yeah, so this is really tricky. We definitely can help with that if you guys need help. But I think knowledge is the first component in this conversation. And as a health center, as an agency, or as a community-based organization, I think as much as you can get informed, the best. And the way to present yourself, being confident and just showing them that what you are saying is not something that you are making up, it's just what is going on and what reality is, and presenting with resources and with options in case you have cases that you have to follow up is a good way to present. Unfortunately, we are in this area where stigma is a high issue for everyone. But it doesn't mean it is impossible to reach that community. Sometimes even talking with providers is tough, and they don't want to talk about HIV, or they don't want to talk about PrEP. But resources are available, information is out there. And if you want more information how to approach to either way, community or providers, I will happy to send more information to you, and just let us know.
Awesome, thank you. And then there was a question too about the statistical effectiveness of clean needle services. I'm assuming maybe that's kind of talking about or asking about, how syringe exchange, any data around syringe exchange and impact on reducing HIV rates. Is that kind of what you were after, Cody? Yes, okay. And Marcial, you're certainly welcome to speak to that. I'm happy to jump in and support you too.
Well, I can just pass it to you, Randy.
Okay.
You're the one. So go ahead.
Yeah, Cody. So I'm the syringe exchange program manager here in Idaho, and that question is totally my bread and butter. So I mean, there's a lot of data nationally that shows that there's about a 50% reduction in HIV among people that use sterile syringe services. But there's a lot of different factors, I think, that can influence that. And we do have a presentation here on September 22nd around harm reduction. It's part 6 of this series. And our colleague Evan Burke from Idaho Harm Reduction Project will be talking a little bit more about the role of harm reduction philosophy and strategies and kind of impact on infections like HIV, hepatitis, overdose, those types of things. So definitely join us then. But they do make a large impact on reducing the spread of infections among people that are injecting substances in particular. Awesome. What other questions do you all have for Marcial about HIV or HIV prevention strategies that are being implemented here in Idaho? I think too, it is exciting, the Take Me Home program where folks can go online and request at-home STI and HIV and hepatitis testing is quite novel. I'm not sure if Marcial, you want to speak to that a little bit. I believe we're one of the first states trying that in this way.
Yes. Kevin, do you want to provide more information? You were the one who established this.
Yeah. And I think what you're referring to, Randy, is the let's get checked.
Yes, sorry, let's get checked. Sorry.
Yeah, no, it's okay. They're kind of similar, right? Take Me Home is just the HIV test kit, and they get the results in 20 minutes at their house. Most people might be familiar with that. You can buy those anywhere, but for us, people can go online and order the kit, goes to their house, and they get their results. And Let's Get Checked is a kind of more detailed free service that's also delivered to their house, but they have to collect samples, a little urine sample, and then the finger prick for hepatitis, HIV, and syphilis, and then they mail that back. It's all free. Then they can go online and get their test results. If anything comes back positive or reactive, they get a phone call from a nurse that then helps coordinate the linkage to care piece. So we think that those are really great opportunities for folks in Idaho and rural parts of Idaho, and those that may be just apprehensive to access care at a clinic. But we, as with anything like that, our Let's Get Checked component or project, we're seeing a decent number of orders right now for those kits, but the return rate isn't quite where we want it to be. But I will say anecdotally that we are seeing a decent, it sounds weird to say that out loud, but like a decent positivity rate for chlamydia and gonorrhea from those kits that are returned. So that means the need is out there. So we're excited about that.
And just to give you a sense of how that looks like, it's just like this. It's just a small box, and inside you will have all the tools that you need to collect the samples. And in the bag, you have like a label saying, okay, you have to return your samples in the same box. So it's a pretty cool and kind of nice box that you will get. And yeah. So anyway, you have our contact information. Please feel free to let us know if you have questions or if you would like to utilize one of our services. We will be more than happy to provide you more information. Yeah, so thank you for your time.
Awesome. Thank you so much, Marcial and Kevin. Thank you everybody for joining us today to learn a little bit more about HIV prevention initiatives that are being implemented in Idaho. So just as a reminder, a recording and slides from today's session will be added to the Northwest ATTC website shortly. If you attended this live session, I think Meg had put a survey requesting your feedback in the chat. And you will also receive a certificate that can be used to obtain continuing education credits. So we'd love for you to join us for the next part of this series, which will be on Wednesday next week, September 14th at noon Mountain Time, and we'll be talking about viral hepatitis. Thanks so much, everybody. Have a great rest of your day, and we'll look forward to seeing you next week.